Hello everyone, my name is Currency Sansoras and I'm going to be talking to you guys about gonorrhea. What is gonorrhea and how is it acquired? Gonorrhea is a sexually transmitted disease. The same bacteria that causes gonorrhea can also infect the genital tract, the mouth, or the anus. It is very common in young adults, particularly those in the ages of 15 to the early to late 20s. It is passed through vaginal, and anal, and oral sex. It can also be passed to young infants. When a pregnant woman gives birth. Symptoms. Gonorrhea does not always cause symptoms, which is why it's very important that you get checked regularly for any sexually transmitted disease if you're being sexually active. But in men, for particular, it can cause pain when urinating and discharge from the penis. If left untreated, it can cause problems with the prostate and the testicles. For women, on the other hand, early symptoms of gonorrhea are very mild or hardly don't have any. Later, it can cause bleeding between periods, pain when urinating, and increased discharge from the vagina. If left untreated, it can cause pelvic inflammatory disease, which causes problems with pregnancy and infertility. Gonorrhea in the United States by sex. In 2018 alone, a total of 583,405 cases were reported in the United States, with the rate of 179.1 cases per 100,000 population. During 2014 to 2017, the rate of reported gonorrhea cases among males was higher than the rate among females in 2018. In 2017 to 2018, gonorrhea rate among males increased with a ratio of 200 to 212 cases per 100,000 males. The rate among females increased 83.6%, which is a rate of 140 to 145 cases per 100,000 females. Gonorrhea in the United States by age. Among females in 2018 alone, the highest rate among females were observed among those aged 20 to 24 years old, with a ratio of 722 cases per 100,000 females. For 15 to 19-year-old females, it was a ratio of 548 cases per 100,000 females. Among males in 2018 alone, the rate was highest among those aged 20 to 24 years, with a rate of 720 cases per 100,000 males, and 25 to 29 years, with a ratio of 674 cases per 100,000 males. Prevention and treatment. Prevention includes correct usage of the latex condoms, which greatly reduces but does not eliminate completely the risk of catching or spreading gonorrhea. The most reliable way to avoid infection is not to have anal, vaginal, or oral sex with multiple sex partners. Treatment. Gonorrhea can be cured with the right treatment. The CDC recommends a single dose of 250 milligrams of intramuscular ceftriaxone and 1 gram of oral azithromycin. It is important to take all of the medication prescribed to cure gonorrhea. Medication for gonorrhea should not be shared with anyone. Although medication will stop the infection, it will not repair any permanent damage done by the disease, such as infertility or damage to your fallopian tubes. Successful treatment of gonorrhea is becoming more difficult due to antimicrobial resistance in gonorrhea. Gonorrhea has developed resistance to the antibiotic drugs prescribed to treat it. Following the spread of the gonococcal resistance, the cephalosporin antibiotics have been the foundation of recommended treatment for gonorrhea. But in the emergence of cephalosporin resistant gonorrhea will significantly complicate the ability for providers to treat gonorrhea successfully. Since there are very few antibiotic options left that are simple, already well studied, and well tolerated, and that have proven to be highly effective. This is what gonorrhea looks like in the oral cavity, and also the image on the right is what gonorrhea looks like on the female with, as you can see, discharge. Stay safe, you guys. Just a final reminder. And these are two sources, which are the CDC, where you can find more information about gonorrhea. And also, if you live in Los Angeles, you'll know that there's plenty of Planned Parenthood clinics near our city that provides STD testing at a low cost or possibly even free. So there's many resources out there to stay informed. And these are my references. Thank you.